Today is World Mental Health Day. This day is observed on the 10th of October every year. It is a day that is observed globally to educate people and to raise awareness and advocacy for fighting the social stigmas surrounding mental health. It was first observed in 1992 at the initiative of the World Federation for Mental Health, a global mental health organization with members and contacts in more than 150 countries. On this day in October, worldwide, thousands of supporters take part in annual awareness programs that bring attention to mental illness and its major effects on people's lives.
On this day, many activities are organized to raise public awareness about mental health and to correct discrimination and misconceptions. The latest trend is the focus on the protection and promotion of mental health. It focuses on the prevention, early detection and quality of care for mental illness.
In Mongolia, this day has been observed every year since 2010 under a specific motto. For this year's World Mental Health Day, the World Health Organization, together with partner organizations, United Global Mental Health and the World Federation for Mental Health, is calling for a massive, scaled-up investment in mental health facilities. To encourage public action around the world, the World Mental Health Day campaign is kicking off in September with the message, "Move for mental health, let's invest."
Due to the global COVID-19 pandemic, the need for mental health services has increased as never before. However, funding has not increased significantly. In general, in order to improve the service and deliver it to the people, it is necessary to allocate more funding.
Today, 1 in 4 people worldwide suffer from mental illness during their lifetime, and 5 out of 10 may end up with a disability due to mental illness. In our country, people with mental illness make up 15% of all the people who have lost their ability to work.
Depression is one of the most common mental illnesses in general. Depression impairs a person's ability to work. At the very least, a depressed person cannot get out of bed and communicate with others. There may also be anxiety disorders and addictions. When a person has been drinking, he cannot focus on his work the next day. These underlying mental illnesses interfere with daily life.
Mental illness can negatively affect people in their daily life and cause behavioral changes. It also has many negative associations with alcohol and drug abuse, violence, crime, and disability, which all impact other people and a country's development.
The person may not be aware that he or she is suffering from mental illness. It can be known from physical pain, such as high blood pressure, heart attacks, and various elements. Among them, doctors must be vigilant and guide the person in the right direction. At the initial stage, a lot of people are seeking help, and then the doctor should direct them to the right place as soon as possible.
Countless numbers of people around the world living with mental illness are often deprived of their rights. They are not only discriminated against, but also often emotionally and physically abused. In our country, the lack of qualified mental health professionals and quality care is the root cause of their rights being further violated.
It can be said that psychologists graduating in Mongolia have not learned the techniques of psychological counseling. But there is a growing demand in Mongolia. There are problems with many people. That's why psychologists who have just graduated from school start giving psychological advice. When I was studying psychology counseling at the National University of Mongolia, there was only one class. It is totally inadequate to give advice after one lesson. Psychiatrists diagnose and prescribe medication. They also need to learn proper counseling techniques.
The World Health Organization has found that chronic illness is associated with a rapid deterioration in health. Mental illness is defined as a chronic disease Non-communicable and chronic diseases are currently the leading cause of death worldwide. One of them is depression. According to a recent study on the prevalence of common mental illness in 15 countries in the Asia-Pacific region, Mongolia ranked 7th.
In total, it is estimated that more than 20,000 people are under observation. Alcohol-related problems are on the rise. Improved diagnosis also reveals increased depression, anxiety, and explained physical pain. One of the biggest cues at our hospital is stress-related mental illness, which is what hundreds of people call the fatigue department. This shows that there is a lot of stress in society. It is related to the fact that people are deprived of sleep and food, and often it can be related to the wrong lifestyle.
The National Center for Mental Health is the only hospital in Mongolia that treats people with mental illness. The hospital was established 90 years ago and treats patients from all over Mongolia.
There are currently 580 people admitted to the mental health center. Our hospital provides pediatric psychiatry. There is also an intensive care unit for the first time to admit a mentally ill person. The Department of Addiction Pathology treats people with addicted to alcohol, tobacco, and other drugs. An innovative activity is that we have opened a 24-hour counseling and information hotline.
In 2018, the Swiss Agency for Development and Cooperation and the World Bank released a report on access to mental health care. According to the report, 3% of Mongolia's population has some form of mental illness, while 38% have a mental health problem or are more likely to suffer from mental illness. For example, 18.5% of people with mental health problems were diagnosed with anxiety, 17.1% with insomnia, 16.2% with chronic fatigue, 6.6% with depression, and 6.2% with alcoholism. The study shows that mental illness is on the rise in Mongolia.
One has to be very careful with oneself. A healthy person does what they like to do, and when they have a rest, they can be relaxed. They should be able to talk freely with their friends and not feel that everything is complicated. However, when you have a problem, your ability to concentrate is reduced. You can do what you want to do in one breath. You suffer from low self-esteem. You don't sleep well, you don't get job satisfaction, and you can get angry. Be aware that you should seek psychiatric care if you have any of the symptoms.
People seek help from psychiatrists at the National Center for Mental Health and from their province or district psychiatrists, but they may need to seek psychological counseling, perhaps privately. Clients with mental health problems can call 1800 2000, a 24-hour hotline, to get information about mental health resources. Caller information is kept confidential and is used for assistance purposes only.
Even if we have a cardiovascular disease or a kidney disease, we must take medicine and go to work. Also, if you have a disability, you can still go about your work. But if you have a mental problem, you will lose your health and ability to work. It is important to have a basic understanding of why people get sick. So you need to pay attention to your psychological education, then everyone can help themselves.
It is estimated that 20 to 25% of the world's population suffers from temporary mental health problems. If society is in crisis, it can fluctuate up to 70% of the population. Therefore, if people can solve their mental health problems in a positive way, they will enter into a healthier psyche. If left unmanaged, they can lose their way in life. Let's protect our mental health and live a healthy lifestyle.